my acoustic neuroma was discovered in June of last year. I had been taking flight lessons and was missing some of the tower calls and was getting concerned about that. So I went in and had a hearing test and found that I had significant asymmetric hearing loss in my left ear. And as typical of that situation, they order an MRI to rule out any brain tumors. And so I had an MRI and kind of knew right away from the physician that discovered it that I had an acoustic neuroma. For me, knowing that I had a brain tumor meant that I had to do something to get beyond that. I had to get it out of me so I could go on with my life and do the things that we love to do. We got the feeling that the other physicians were reticent and maybe a little afraid of doing the surgery because it is in a very difficult location of the brain. And when we met Dr. Friedman, we could feel the confidence that he exuded. He was so positive. You know, he said, "I'll have you back flying, I'll have you back paddleboarding, I'll have you back golfing, I'll have you back tennis." He really made us feel good about, you know, the suffering that we'd been going through in terms of what decision to make and what was the right course for me to take.
Kevin was diagnosed with an acoustic neuroma, or vestibular schwannoma is what they're really called. And part of the reason for that is the MRI can't always tell which of the nerves the tumor's on in this little bony canal. Turned out when we got in there, it was on a part of his, what's called the facial nerve, the nerve that moves the face. It's involved in facial expression, but it's a little branch that has some other function, and turned out to be a good thing because it was far enough away from his hearing nerve that we preserved his hearing. It wasn't on his balance nerve, so we were able to preserve his balance function. It was near his facial nerve, so obviously risky for facial nerve weakness, which is really debilitating. And Kevin is healed beautifully. His functional outcome is great, his tumor's out, and really excited about his progress.
From the first appointment when we met Dr. Friedman, he put our mind at ease. We knew we had found the right surgeon. His compassion and thoughtfulness was very apparent, and we felt so comforted.
Based on my experience, I have no hesitation in recommending the USC Acoustic Neuroma program led by Dr. Rick Friedman and Dr. Steven Giannotta. They, as a surgical team, are at the top level of their field in the world. I understand that people travel from other countries to come here to the USC Acoustic Neuroma program to have their surgery. They come from all over the nation. And it's the expertise here at USC Keck that doesn't exist anywhere else.
Dr. Giannotta and I really are the principal surgeons in this program. Although the program is growing, our patient hospital stays are showing how sort of comprehensively we care for them, both from the beginning through the process and at the end. And we stay with them for life until they, feel like they don't need us anymore.
Kevin is doing remarkably well, and we're so grateful to Dr. Friedman and his skilled hands. We feel very blessed to have come across Dr. Friedman and his team of doctors and all the staff here at USC. A wonderful team, and we're grateful for Kevin's wonderful recovery.
We had the surgery in November of last year, so this is approximately 4 months after the surgery, and I would say I'm back to where I was. I'm still doing some physical therapy, but I've skied, I flew last weekend, I'm playing golf again, I'm paddleboarding, and I'm doing all the things that I love to do. And it's all thanks to the USC Acoustic Neuroma program.